Hello, I'm Dr. Khamisa, a consultant hematologist in Ottawa, Ontario. Thank you for asking me to speak today about iron deficiency anemia in women of reproductive age. Anemia simply means a lack of red blood cells. Red blood cells are important to carry oxygen around the body. Iron is the most important element in these red blood cells. There are many causes for anemia, but in women of childbearing age, the most important cause is due to low iron. The reason why iron deficiency anemia is common in women in this age group, for the most part, is due to monthly menstrual bleeding losses. Other causes of low iron include poor intake from diet, poor absorption of nutrients, such as seen in conditions such as celiac disease, or rarely there could be serious gastroenterologic problems such as colon cancer or colitis. Most of the iron in our body is actually used to make red blood cells. Iron is also important for muscle functioning, building enzymes and hormones that are important for well-being and function. The symptoms of anemia include fatigue, dizziness, and pale skin. In addition to these symptoms, women with iron deficiency anemia can experience hair loss, brittle nails, restless leg syndrome, and symptoms of depression. If the anemia is serious enough, some patients experience heart attacks, strokes, and loss of consciousness. There are simple blood tests that can help diagnose anemia and iron deficiency anemia. The two tests that a physician will usually ask a patient to do are the complete blood count and ferritin level. The complete blood count measures the number of red cells, white cells, and platelets that are in a person's blood. These are elements made by the bone marrow. The hemoglobin molecule is part of the red cell that carries oxygen around the body. It is such an important molecule that is the level of hemoglobin that actually defines anemia. Ferritin is the storage molecule of iron in the body, and when the ferritin level is less than 30 micrograms per liter, the patient is iron deficient. Keeping the ferritin and hemoglobin in the optimal range and with optimal levels leads to improved quality of life in young women, especially those of reproductive age hoping to become pregnant. The recommended daily intake for women of this age group is 18 milligrams per day of iron. Meat, pumpkin seeds, and certain legumes are good sources of iron. Despite eating well, iron deficiency anemia may still develop if a woman has prolonged, heavy menstrual periods. It is important for a patient's physician to explore the underlying reason for a patient's iron deficiency. This may involve further blood tests, such as blood tests for celiac disease, or may involve further referrals to a gynecologist or gastroenterologist. Once a diagnosis of iron deficiency anemia is made, patients are typically prescribed iron tablets or pills. These pills are available readily at most pharmacies, sometimes without a prescription. If you have anemia, it is important to confirm with your doctor that the reason is due to low iron before you start taking iron supplements. When taking oral iron, it is helpful to keep hydrated to increase your fruit and fiber intake, and this will help prevent constipation, which can be seen with taking oral iron tablets. Intravenous iron can be used in patients with poor tolerance or poor absorption of oral iron tablets. Prior to becoming pregnant, women should try to ensure their iron levels are optimal. It is estimated that 30 to 60% of pregnancies are complicated by iron deficiency anemia. As women move from the first trimester to the third trimester, their iron needs increase in pregnancy. It is estimated that up to 75% of women who are pregnant have iron deficiency by their third trimester. Women who have low iron in pregnancy risk preterm labor, postpartum bleeding, or hemorrhage and fatigue. Iron deficiency anemia does not just affect the mother, but can affect the baby. Complications for the baby include low birth weight, small size, fetal distress, and preterm birth. Women who are pregnant should take 27 milligrams of iron per day, and this may be not sufficient in some cases. Women who are pregnant and iron deficient may sometimes require intravenous iron. This will help prevent maternal and fetal complications. If you think you have iron deficiency anemia, speak with your healthcare provider about getting blood work to explore this issue. Thank you for tuning in to this episode.